There we go. Welcome back, listening audience. Thanks again for joining us. I am Jake Wiskerson. I always announce that in the intro, and I don't know why we re-announce it here, but now everybody knows who I am twice. We're joined by Ryan Malphrus, who is a clinical social worker in the Washington, D.C. area. But you're where? In Virginia?
Maryland.
You're in Maryland.
Maryland.
Okay.
Yep.
So, uh, I first got to know Ryan through Stephanie Wynn podcast. You must be some kind of therapist, a friend of the show, Stephanie Wynn, I might say. And he was talking about how we're basically having this like crisis of masculinity and boyhood, and how we're suppressing boys' ability to be boys. And you've spent a lot of work in schools. I'll let you introduce yourself, but that's the topic for today. I want to get this out, and there's some recent context for why this is important now. But why don't you introduce yourself to everybody? Tell everybody who you are, and I already told them what hood you rep. So
Sure. Yeah, Ryan Malphrus. I am a clinical social worker, but I would describe myself as a psychotherapist, as that's the only thing that I do right now. So, like professionally, what I do is give therapy. That's the only thing I've ever wanted to do. I'm a weird guy. It was a weird profession for a little child to want, but that was kind of how I got to where I was. Is that I became a social worker not because I have a affinity to social work, but because it was the fastest 2 year degree that didn't involve me writing a thesis, and I don't like school. So a lot of self-learning involved. But as you mentioned, I worked in schools, and I worked in the special education schools in and around the DC, Maryland, Virginia area. And that is a population that's, I would say roughly 90 to 95% male. So I have a lot of experience just working with the, kids, adolescents, mostly older adolescents into like seniors going into transitioning into college. And just seeing some of the unique challenges that they have. And then also being a guy, I have dealt with some of these things. And I think about them quite often of how my life has been impacted by, the recent years and societal changes over my lifetime and some of the challenges that have come along with it.
you, I think I heard you say something like there are 90 to 95% of the population you're working with is male. Do you mean the special ed population or
Yes,
the
special.
entire school? Okay.
No. Special education specifically is a highly male population. I don't think it takes like a rocket science to realize that men or and boy behavioral issues tends to be more violence, aggression, hyperactivity, which schools don't like. So it's my schools were a place where if you couldn't be educated in the public school system, we have laws involved. The public school system has to provide every citizen of our country, an education. So they get sent to our schools, but the public school systems cannot manage the behaviors or provide, the academic curriculum needed for those kids.
You've been doing this for how long? Not therapy, but the school
Um,
stuff.
I graduated in 2010 and I was in the school systems for roughly up until COVID. I left a couple of years. I did it for almost 12 years.
So is this an emerging trend that the special ed population is overwhelmingly male, or has it always been that way, dating to as far as you can remember?
I mean, ever since I was in it, it was almost always very largely male, like significant and I don't know about before my time, but since I've been there, it was almost always, you might have one girl in a class, maybe.
Okay, so I'm trying to frame this properly because I also taught in schools and am very familiar with the K-12 system. I did not do special ed per se.
Mhm.
I did happen to have a stint running what they called the SIP or social intervention program classroom for the kids who couldn't tolerate normal classroom. And now you can't just put them in the hallway when they misbehave, right? Because there's something
Mhm.
about supervision and whatnot. But agreed, those kids with the problematic behaviors tended to be boys. However, my historical understanding, and this dates to my childhood, is that special education was for learning disabilities and cognitive impairments and things that pertain to a child's ability to receive information in a school setting. But what you're describing, which now I'm shocked that I'm having this revelation at this very moment, given my involvement with the K-12 system, special ed is overwhelmingly tilted toward behavioral interventions and not necessarily academic. Is that
So
true?
the schools that I was in, and so each of these schools
Okay.
usually target a different population. In the overall, like it was a for-profit company that I was working for. They had different schools that target on different disability classifications. So there were schools that were primarily learning disabilities as well as autism focused, and those programs were a little bit different. Then I also worked in schools. The ones that I enjoyed most working in were the social, emotional, behavioral issues. And so the line that you have at these schools is the pretty much you are given it with IDEA, and I don't remember exactly what that acronym means, I think Individuals with Disability Education Act, and it
Yes.
classifies different disability classifications. Essentially, for behavior, it is your social, emotional, behavioral challenges or dysfunctions are impeding your access to the academic curriculum. And so that is how the curriculum matches up with the behaviors, that your behavior is so, difficult or can be not managed in the classroom that we're telling you can't access academic curriculum, and so you need special education services in order to do so.
And that tracks, right? So that all nests nicely under the umbrella of educational intervention. But we're talking about problematic behaviors, and I'll put that in air quotes for the
Sure.
listening audience who can't see the video. Problematic behaviors that heretofore were probably not problematic, they were typical. Now, in my opinion, is I think shared by you, which is that we have over pathologized normal childhood to the point that we need this type of stuff when previously we just kind of rolled with it because boys do boy things and girls do girl things. But something has happened now, something has changed where these behaviors are deemed quote unquote problematic instead of typical. What's your read of that? And then we'll get right into it because two therapists talking about this stuff thrills me to no end.
So it's interesting. So where I worked, these kids had legitimate problems. So this is the end of the road essentially before you go into residential placement.
Okay.
So I would say the population that I worked with were not the kids that were maybe overdiagnosed and more just typical behaviors. These kids, this is I'm in a school, we would, physical restraints were a commonplace, fights were every day, there's violence almost every day. So I mean, it was a pretty intense environment with some pretty, challenged, children there. But I also now in the private practice sector where I find myself now, I am now dealing with a lot of families in my area, which is often a child is identified as having a problem. And there's always a question is, does this child have a problem or a mental health issue, or is the family functioning not up to par and able to manage that child's needs? And often what happens is, well, if I can send my child somewhere rather than me as a parent working on my home, myself, whatever the issue may be, I do see a tendency to identify a child as the issue as opposed to the family unit or even the school system, whatever the context that the child finds themselves in.
Yeah, this is something that's near and dear because at Zephyr, where I, operate this practice, we have a we don't do fix my kid policy, and it doesn't read like that in the intake, but it says something to the effect of, as executives of your home, the parents are responsible for the children as go you, so go the children. So you can expect that we're going to work more with you. And we reserve the right to terminate care if you don't want to participate, because this isn't
Mm,
jujitsu. You don't drop them off for an hour and come back and have more skills, right? Because if it is the environment and the parents are deficient in their leadership within that environment, of course the child is going to have problems,
of
but
course.
it's not necessarily their fault or theirs to correct because the adults are not doing their jobs. So that tracks. What's the pipeline here? What are you seeing as the origin of how these kids end up in that type of setting before, the last chance before they go into residential care?
I mean, these kids were a really sad situation. So, I mean, one of the most like the very basic things we would often talk about as staff is there would be maybe one or two children. And the kids, it was K through 12, maybe like 100 kids in the school and over the entirety. There would be maybe, let's say, five of them with an intact two-parent family household.
Hmm.
So these are children that are either in the foster care system, being raised by grandparents, or a single parent, which is just, as a parent myself, like I would have just overwhelmingly challenging, just not having another person to balance me out, help me out, and do all these things. So that was one of like the first things that you just kind of notice is that they're, the actual home support systems are insufficient. And not this is not like a value judgment on the people that were raising these kids. It was just it is hard to raise
Right,
kids, and to
right.
do it yourself is impossible in some sense. It's like I rely on my wife who's now cooking and taking care of the kids while I go do this, and I need her to be a part of a team unit to have our family function. So I would say that is one of like just I think we've known about this scientifically for a long time that this is a major challenge. And so that would be the first thing that jumped to my mind when you asked me that question. Is like, yeah, there's just not a lot of two people in the household. And I mean, unfortunately, primarily fathers not in the home was also a trend along the lines of kind of what I'm talking about.
What's your interventions there? You're only a hired gun, right? What do you do?
So at the school system, there's almost nothing you can do. And so it was one of the reasons I left the school system. So at the school systems, again, the child, because of the nature of the system, the child is the one identified with a problem. The parents have zero responsibility, and the school has no power to enforce any responsibility upon the parents, essentially. So we would have kids that would be at this school for, I don't know, 2, 3 years. We would never see their parents. Or maybe once a year at the IEP meeting, so it's an individualized education plan, and once a year you have to review and update that. We might see a parent, but sometimes no, they just call in. And so there is just no connection between this child and the parent. And so often the school wants more involvement, but there's nothing we can do. And so it was very discouraging. There's an expectation that me as the clinician, I get this kid for, I don't know, 30 minutes a week, an hour a week. I'm going to do something with them and radically transform both their lives, and then they can go home and transform their families' lives. And it just all is very unrealistic. That is just not how these things tend to work. So now in private practice, and I have actually been changing things, I think, a bit more to your take. And I spoke with someone recently that I'm going to put an interview out with. His name's Nick Tabor. I don't know if you know who he is on Twitter, and he's very focused on the authoritarian practices of the school systems and how we often blame the child and scapegoat them for this. And I've actually really changed a lot of my practices now. I just won't work with adolescents even without parent involvement. It stopped making sense to me where I'm trying to, work with this person who may have some legitimate challenges and may need some things, but often you have parents whispering in their ears, their expectation you're getting influence here. It's like, hey, why don't you come in? Why don't we all come in and figure out what's going on rather than having the person who's easiest to get into my office, which is often the child, because they don't have power to say no to this thing, or they don't know any better. So I've also been changing my practices due to what I found to be ineffective. I didn't find my work with kids to be all that effective because they were still going home to the dysfunctional system that to me was a root cause of a lot of the challenges that they were having.
What's your reception been when you pitch that to the parents? And I'll tell you what ours has been after your training.
So this is recent. So far so good. I don't have too many problems, and it's almost a relief. I think the last parents that I spoke to was they're like, yeah, I think that sounds like a good idea, but it sounds like so many of the problems are not that your child is a problem, but your expectation of who your child is butting up against who your child actually is, and that is becoming a problem. And I have so far have been open to it, and I think it's been helpful. So
That's encouraging. So we did this transition back circa 2018, I want to say, when we changed
okay,
our intake form, and we were apprehensive that it would not work. And it turns out when presented properly in the way that I described it, the parents want that ownership. They do want to create structure. They don't want to outsource their parenting to anybody else, including a therapist or the school. They also have some resistance because it requires looking at their own selves, capital S, and what they're doing maybe inappropriately or ineffectively. But by and large, they signed on, and it was really richly rewarding. Now, in recent weeks, very recent, like 6 to 7 weeks, I'd say.
that meme's dead
Um,
according to my kids. You can't say it
six,
anymore.
6, 8, yeah. I have taken the stance, and it's going to sound extreme, and I intend it that way because I'm going
Okay.
to back off of the extremity. But I don't know that our profession should be treating children, period.
Uh, so this was that conversation that I had with Nick, and I think I'm jumping on board with this. Um, it's interesting because kids seem very unaware very often of why they're there.
Hmm.
Um,
Hmm.
and so it seems unfair that I am then implementing something or doing something against your will that you don't really fully understand. Like
Yeah,
informed
there's a
consent's not possible.
yes.
And I tried my best to say, hey, this is what we're doing, this is what I'm trying to do with you. But at a certain level, unless you're coming on your own volition and consenting to my services, there is a part of this very uncomfortable. And it was a struggle that I had my first, I don't know, like 6, 10 years. I would always be like, I don't like this idea that I am manipulating children to be things that I want them to be. And that is what is happening. That is what behavioral modification is. We can sugarcoat it. We can call it all these nice euphemisms, which I really hate euphemisms. But really, what we're doing is I'm dictating that in the school, I want you to behave this way. And I'm going to essentially trick you into doing this or punishing you out of doing something I don't want you to do. And that is just, if we're going to be honest about it, that's kind of what's happening. I was always very uncomfortable with this. And you try to make it work, and in some situations you're like, listen, some of these kids are violent, and if I can get the violence out of them, that is going to be good for them. So you rationalize, all right, the manipulation essentially, and I'm being kind of extreme with the words as well, but you rationalize the manipulation because it's going to help them in the long run. And I do think that is the case sometimes. There are some behaviors that are so destructive that you would benefit of me essentially forcing you to this behavior out of you. Now, it gets weird when you're getting to the more nebulous things where it's like, being able to sit in this chair for 3 hours and do math. I don't know if I can really make a good rationalization why I should be manipulating you into doing that. I'm a lot less
Right.
comfortable with that.
Yeah, there's a fundamental consent issue and you touched on that earlier. There's the old adage of, I don't know if it's an adage or a joke or whatever, but it's, how many therapists does it take to change a light bulb? And the answer is one, but the light bulb has to want to change, right?
Mm,
So many, many years ago, I found myself working in adult drug court here locally, and it was a lot of, we call it mandated, but in my world, that doesn't play. There's no such thing as mandated. There's a choice to do something or there's a choice to do something else. And these folks were facing prison time if they didn't take the alternative diversion sentence, and that included counseling. And so I would just, meet them where they are in the spirit of Christian Kantian yield theory and say, "Hey, man, you don't have to be here." "Yeah, I do. The judge is making me." "No, you chose to be here." So starting from that and
mm.
getting their buy-in was a great leap toward doing whatever we're doing. Now, prior to that revelation, I was working in home with children doing what's called psychosocial rehabilitation or basic skills training, PSR, BST, we call it. And it was that scenario you just described. The kid doesn't even really know why they're there other than like my behaviors, my anger, right?
Yeah.
So from there, I evolved into soliciting consent from the child, asking, "Hey, do you know why you're in my office? This isn't a punishment. I'm not some heavy to try to fix you." And if they understood it, we probably could do some good work. But if the parents weren't involved, it wasn't sustainable in the home. So then I transitioned to that thing in 2018 where it's like we're just gonna require the parents to be involved. Now, like I said in recent weeks, I've gone to we shouldn't be treating children, and I understand that there are exceptions. So we'll back off of that extremity and say some of
Of
these
course.
exceptions might include teenagers who are about to launch and are capable of integrating some new information, taking control of their own lives in spite of their parents. Some of them might be
Yes.
foster children whose parents are not anchored, or there's a revolving door of parental figures, something like that. That's probably appropriate to do some therapy with the kids, whatever form it takes. But I think that we've been bathed in this idea that children can be an identified patient for so long, many decades, that saying something like that runs afoul of the orthodoxy to the point that we end up getting blowback. And I don't know if it threatens people's, professionals' egos around, "I'm a play therapist, I'm a child therapist," whatever, or if it's just that we simply can't conceptualize the systemic nature of families. I don't know, but what I do know is that people are craving so badly to have order restored in their homes and have the child become a fruitful member of society, that in whom they can be proud, that they sign on for it, right? But removing the child altogether from the counseling setting and focusing only on the parents is is a pretty easy sell job. The billing part with the insurance is another matter. But I want to center on just the idea, the concept of getting upstream from the child for a second. So tell me a little bit about this private practice that you've been doing, the success that you've had, and how those conversations go. Because I want to move towards solutions, but then go back to what's happening society wide in the I guess you could say the assault on masculinity as well as the assault on femininity. Kids don't know who they are in their own bodies anymore.
I mean, I always try to be honest both here and with my patients that I don't know how successful it's been. It's so new. I don't think I can make a claim to whether what I'm doing is effective or not. All I try to ever do is try to be able to articulate what I am trying to do, and then you get to decide whether you're on board or not. And that has always been my strategy. Even when I was working with kids, my line with kids was like, my job is to help you get what you want in life. And I really felt like that was my job, is that, if there's something you want, let's figure out like ways that actually work to achieve whatever that goal is that you have, figured out it is. And what my at least experience has been when you can just be very honest with people and it's like, hey, this is what we're trying to do. And as you said, you can decide to do this or not do this. I'm not going to require any parent to come. You don't, there's other, and a lot of these parents, I say, there are other clinicians that specialize in family therapy. I don't. This is something I'm kind of learning as we're going. I have a relationship with you and your child. I think I could do it, but I want you to be very clear that this is where we're at, and you have a choice to make now. What do you want to do? And same with the kids in the schools. It was, yeah, you're mandated by the law to come see me, but you could absolutely just sit in your chair and not come to see me. Like that's an option that you have, and I refuse to do anything to coerce you into that. So, I mean, that's fine. That's a choice. You can make that choice. I'm just gonna write a note that said you refused. Okay. I'm not gonna. So my experience has been if you just lay it out on the table and give people the choices, they tend to do the thing that they're like, oh, that sounds like it could be helpful. And I think one of the things that I am trying to do right now, especially, is I think our profession needs to do a lot better job articulating what we actually are doing in the room and like what is actually even happening. What is
Yeah.
the purpose of therapy? There's no quick fixes. How long this actually takes. How difficult these things are. Coming to grips with some of the things that you've done yourself, or as you're talking about that bitter pill you have to swallow as a parent that you harmed your child and some in your attitude and your bad mood. And I'm talking about myself. It's like if I have a bad day, I will be mean to my son, who I
Yeah.
love more than anything in the world. And I'll realize later, I'm like, that was a horrible thing that I did. And it's painful because I love him so much, but I have to swallow that pill and go apologize. I'm like, dude, sorry. Maybe your mom and I were fighting or whatever, and I took it out on you. My bad. And that is so hard to swallow. And so recognizing with parents that, we have to gently and very openly say, hey, you guys are all in a family together. You're probably having some role in this. Not all of the role, but some of it. And if we could figure out how to do it better, not that there's someone, a villain or like a hero in any of these stories, that's often how it gets played out. It's that something's not working. You're calling me because you know something's not working. So let's see if we can talk and figure it out together. And that's what I give no claim of any ability other than like, hey, I'm kind of good at recognizing patterns and I'm going to give you my thoughts on what I think's happening here. I have no magic. There's no special skill I'm going to give you guys that's going to fix your family in 10 minutes, but I can try to, pick up on some things that I notice over time as you guys are together.
Three things jumped out at me. One, I don't know, take them one at a time. One is that
Good.
I'm curious what their response is when you ask them what they want. Because in my experience, the kid has either never or not recently, and this goes for adults too,
Mhm.
who are in some sort of tough spot in their life. Hey, what do you want to be when you grow up? It's imagine saying that to a 40-year-old. It's like, what do you want to be when you? I'm playful with it, right? And they can't dream. They haven't been allowed to dream. Has that been your experience when you ask them, like, I want to help you get what you want? And they're like, I don't even know what I want.
Yes, and it's not a child problem. It's a everyone problem, and to me, I would say it's indicative of a childhood experience. So I see it of people who didn't have the, let's say, the privilege of having a childhood where they could be a child and still be loved by their parent after a tantrum, or to be, say a mean thing and still know that, afterwards there's going to be a hug afterwards. So I notice a lot of adults that just never consider the question, what do I want? Because my entire survival depended on how do I be what the other person wants me to be. And so I work with a lot of people who spent their entire lives getting really good, and I'll say myself included. I got really good at figuring out what other people wanted out of me to stay in their good graces. And if you do that long enough, you never sit to think about what you want in life. And
Right.
it's a muscle that's never worked out. And so I see that all the time.
Yeah, for me, that looks like vulnerability because if you're actually
Yeah.
saying what you want, you're opening yourself up to somebody having to provide it for you, and then you could get whacked if it doesn't show up, or just told that you don't matter, or your voice doesn't
Yep.
count. And I think that's a really good point. The other two things that jumped out at me sort of dovetail together. One is the idea of being transparent about what's going on in the therapy session, and the other is the authenticity and transparency that you offer about your own struggles. I mean, here you are on a podcast that's going to be listened to at least by dozens of people,
Ooh.
maybe millions. I don't know. But there's you shared that you would be rough or harsh with your own child. I also suffer that, and more often than I care to admit
Yep.
publicly, but it's a lot. And so I'll bring that into session sometimes in order to create rapport, so that it doesn't look like I'm some perfect person behind the curtain pulling levers on their family system. And I think that opacity also speaks to the transparency of what's going on in the session. I think our profession has done a very poor job of embracing or even promoting such transparency and authenticity from the clinician because we love to live veiled lives. We like to, be in the shadows, and I find that the opposite is true. It's more effective to be a human being living in the same community, going to the same sporting events, attending the same churches, shopping in the same Costco, and saying, yeah, I'm not perfect either. I'm working on it too, even though I do this professionally. And then in the session, I don't want to be seen as like some magician I
Mhm.
want to teach them what I'm doing, what I learned in grad school, the books that I've read that they can go implement in their own lives and then never come back. That's my
Sure.
promise to them is that, I'm going to do my best to teach you what I already know so you don't have to use me anymore. How has that worked for you as far as the transparency and the authenticity in contrast with what we're usually taught in the graduate programs, which is don't do that, don't tell them what's going on, right?
I'll give you a couple of my kind of, I guess, little heuristics that I use, and I want to preface this by saying these are mine. I do therapy the way Ryan does therapy because I'm Ryan, and I have a sense of humor, and I'm playful, and you can't get away with the things that I can get away with. And this is why I supervise other therapists, and it's something the first thing that I think that ever talk whenever you're talking about like how do you do things, is that I get to do things now. I get to do things. You got to figure that out on your own as a clinician because you're going to have your own special personality that is going to allow you to do things that I can't do. So one of the things that I think about like disclosure is my little rule in my head is if it comes up in my head 3 times that I want to tell someone something, I might tell them then. But
That's cool.
if it doesn't come up in my head, I ask myself, do I want to say this because I just want to, I want to connect with this person. I want to share something because this is one of these things as a therapist. I want attention.
Yeah, we,
Sometimes I
we do.
like my clients so much that I want to be friends with them, and it kind of bothers me that I can't be. And
Mhm.
so I'm cautious that I'm not doing this for my own needs, but I do think there is value in disclosure that I am a human. So I really like the psychoanalytic and psychodynamic side of things because I love the idea that, hey, you're going to get mad at me in session and bring up feelings, and so am I. And I'm going to try very hard not to hide them from you, especially if you notice them. And so I have found with people, they get at ease when they realize, oh, like, I got kind of annoyed at something, or I was direct with you if I didn't like something, not in a cruel way, but I'm not this infallible, unflappable person that can take anything. I'm a person just like you are. And I think there's a real need for us to not be seen as the good thing. It's one of my missions right now is to make therapists more human. I like the way you kind of said that is that we're very often seen as this thing that's not human, and there's expectations upon therapists that we're all good. And my experience is actually the total opposite. We're all fucking messes, and every single one of us comes from not every, but the overwhelming majority has a lot of struggles, and they're still struggling through their life, and myself included. And I think it needs to be very clear that we don't have it all together. I'm providing a very specific service, which is, again, I think I'm kind of good at pattern recognition and I can kind of share some things that maybe you didn't see. But my answer isn't your answer. And so I tend to actually not share too much other than very basic things. And if I go outside into like, let's say advice giving, so I think advice giving is fine sometimes, is I just say, hey, is it all right if I tell you, like, hey, I've worked out, like people often talk about losing weight and I have gone through my own journey of losing weight and working out. I'm like, hey, do you mind if I just, is that okay if we talk about this from a more factual standpoint? We're stopping therapy right now and we're moving in. I'm just going to tell you something because it seems like maybe you don't know this.
Yeah, that's pretty awesome. It's like you and I are the same person on many levels. The idea of telling them what's going on in the session and what they can expect. I want to make sure I'm hearing you with your ears, not mine.
Yeah.
What do you mean by that when you talk to your patients, your clients? I call them patients, but what do you mean when you say that?
About like that, what's happening in the room
Yeah,
between us. Yeah. Um, so I mean, again, this is kind of a modality thing, but I think any therapist should be aware of transference and countertransference. Like you're gonna have feelings about me, and sometimes they're gonna be about me because I said something stupid or insensitive, and sometimes they're gonna be about someone else, and I'm just the avatar of that other person at that moment. In either way, I want to have a relationship with whoever it is that we're allowed to talk about those things. Because what I try to, in my first couple of sessions, that in most relationships in life, we cannot have those conversations. When someone pisses us off,
right.
we usually suppress that. We don't say anything. And here, not only can we talk about it, but hopefully we can learn something about it that, oh, that's interesting. And so I tell all of my clients that I am used to being on the other side of this relationship. I continue to go to therapy. I do it every week. And one of the things that is valuable for me is that I notice, hey, my therapist said something and it really pissed me off. I tell him, and then we sit down and figure out, hey, why'd that piss me off so much? You didn't like, I know you're on my side. I don't think you actually said anything that was really that offensive, but I had a really strong reaction to that. And those have been some of the most insightful and useful moments. So I'm often trying to encourage by setting the expectations again. What are we doing in here? We're trying to learn things about you. And part of that is our relationship can be a little microcosm of your other relationships. So the same feelings that pop up in your other places, they're probably going to pop up here. So I'm trying to set the stage to say, like, hey, that's a place that we can go to. And now people don't ever go there initially because it's so uncomfortable. But you're trying to invite this idea, and I think some using your own self-disclosure can also invite this of like, hey, I felt a strong thing in this at this moment, or I noticed you said something, and I'm inviting you to tell me. It looked like you kind of thought it was stupid what I just said, and I'm almost inviting them to have this conversation because I guess to me it's just happening. So I'd rather talk about it than have to hide the thing that's just happening.
I 100% agree with that, and that's very psychodynamic of you. And I think, shifting gears a little bit into what's problematic is that in the therapy field and in the education field and society writ large, is that we'll start with therapy.
Yep.
Psychodynamic concepts, and for the listening audience who's not aware of that, what we're talking about is the concept that people have a psyche. Psyche is Greek from the word soul. The Greek goddess Psyche was said to be the goddess of the human soul. So psyche, psychodynamic stuff is the dynamics of your own psyche, your own mind, your own soul. And we could have a hair splitting debate about what those terms mean, but for all intent and purpose, for this conversation, they're the same. So if we go into a person's inner self, their soul, their capital S self, who they are, their divine creation that they're meant to be to walk the planet, we get into a whole field of limitless potential for great and terrible. And what our field has done is moved away from that and toward behaviorism. There's nothing at all wrong with behaviorism. But as you alluded earlier, the idea of shaping behaviors is a manipulation of sorts, and it's done through one's own lens, one's own ego, if you will.
Sure.
And so an ego is a psychodynamic concept of the familiar place, that which you would know really well. And it also will tell you that you quote unquote know everything, right? Like, I already know about this. So that's what the ego will do. And I think behaviorism is largely ego driven based on what we want the patient or the client to do based on our own lens. And that's quite inappropriate because it's very limiting. It's limiting not only to what we think they should be, but also it limits them and what they could be. Part of why I think that this has happened is because behaviorism is just easier. It's easier to
It
measure and
works.
quantify. Yep, yep. And
It
and
just
and we can
works.
make time limited stuff,
Yep.
and we can say, there's the evidence that the thing changed. The kid is less violent now than he was 6 months ago. Great, we win. But we don't ask why. Why was he violent? Why was he doing the things he's doing? Why isn't he able to sit still through math? And that's more of a psychodynamic concept that invites all sorts of new perspectives and nuances. And if we're forgetting those or we're moving them off the table because we're literally not being taught that in our school programs, then we're limiting the individual, and we're also limiting our capacity to help them really fully emerge as who they are and to individuate, to use a Jungian term, or
Yep.
differentiate, to use a Bowen term, same thing, from their family of origin, really embrace who they are, grow into who they're supposed to be. So talk to me a little bit about, because I want to center on why boys, what's going on with boys and masculinity, and this definitely has psychodynamic roots. Tell me
Yeah.
what your angle is on what's happening these days and how do we fix it?
Hmm. Well, first of all, you did a great job on the little theory thing. I could
Oh,
not have
thanks.
done that. I'm so like I had the idea in my head, but I cannot articulate it, and I don't remember any of the words or theorists. But I would say, like, to your question, what's going on? Um, so I'm actually reading a book right now with Jungian ideas, and I know there's a lot of contention over him and his ideas and all that. But I love the idea of the shadow, of the simple idea that there's a part of ourselves that is we're uncomfortable with,
Yeah.
that's still real, and then we try to hide, and we do our best to hide it. And that is what I would say. I have applied this to like a societal lens, kind of at the moment that violence, aggression is something that I feel like we thought we evolved past. There has been playing nice, using nice words, political correctness, I would say is like kind of like the exemplified act. Like this is the symbolic representation of this, of like there is no grittiness, there's no rough side, there's no sexuality, there's no aggression, there's none of this. Um, and I think that does a lot of harm to people because those things, again, they're just there, and I don't believe that we can rid ourselves of those parts of being human. And so we have tried to nice over all of these things and created systems to try to, again, to eradicate these things. And something you were saying before about like trying to manipulate people. I just don't know what's best for you. I don't know what's best for anyone else. I barely know what the hell's best for me. So the idea that I would be, changing a thing about you without your consent and without you guiding this process, this doesn't make any sense to me. And I had a kid after a group session I did one time, kind of, I thought he laid this out perfectly. And so he was a gang member, a very serious gang. And he was like, after group, he's like, Mr. Roberts, like, I get it. why you guys are telling us to do all this stuff makes sense here in the school. If I do these behaviors when I go home, I will get killed. Just straight up. And he wasn't wrong. It's like, I can't be kind to someone that's insulting me. Like that, it doesn't work that way in my community. And it really just dawned on me. I'm like, I don't know what's best. I really don't. And so anything that is has me directing what is quote unquote good, um, seems I'm very concerned by doing that. So even the things that seem bad, like violence and aggression, well, I don't know. And I can speak for
Right. It's through
myself
whose
as,
lens, right?
yeah,
Who's judging this? Yeah.
who knows? And for me, I was someone, so I often will try to, in these spaces, talk a bit more about myself as like a personal thing. So I grew up in an environment where there was a lot of emotional aggression. So there was aggression all over the place and very intense aggression. And I kind of got into my head of like, oh, I don't want to be aggressive because this is very destructive. It makes me feel horrible. So I am not going to be aggressive. I'm going to be a nice guy. And I lived my way for a lot of my life. And, what I came to at some point was, oh, I'm just vulnerable, and I have no tools to stop me from someone predating on me. And I found myself often in those situations where I'm being taken advantage of, and I'm very angry all the time. I'm like, wow, I'm so angry, and people are doing all these mean things to me. Well, I had not developed my aggressive impulses and come to terms with that I am an angry person, and I do have judgments, and I am pissed off. I'm destructive sometimes. Sometimes I'm sadistic, and I want to hurt people that have hurt me. And I couldn't accept those aspects of myself. And I think what ends up happening is that I actually acted out more of those bad impulses when I didn't accept they were a part of me. So I see a lot of what's happening. My concern right now is that you take boys, and I see a lot of acting out on men. They're acting out a lot of these things because they've had to deny this for so long, rather than, is there a healthy way that we can express sexuality, a healthy way to express aggression and disagreement, rather than pretending as if these are bad things in its entirety, rather than, well, it just depends on the context of whether this is anger is protective or destructive.
Yeah. If you start, I mean, to quote Jung again, that which we resist persists. And so if you're denying part of yourself, even though it's in there, it will come out somewhere, and usually not within your control because you've pretended that you don't possess it. And it's a really dangerous game to play. And this shadow aspect that you talk about is very powerful, and it's both good and bad. So I'll use judgmental terms there, but a very good shadow might be the part of us that we don't want to see because we're afraid that we might be super successful and we don't know how to handle it or something like that. And then the part that we don't want to acknowledge, which is the maybe the violence or whatever, limit setting even,
Mhm.
is part that allows us to get run over, and that's not helpful either. So helping people to allow those things to present in a mindful, intentional way is very important. You mentioned the gangbanger. He's like, yeah, this is all great, but I can't do it in my home environment. It's reminiscent of my work with law enforcement and corrections officers
Mhm.
because they can often bring home the residue of the job into the home, right? And then so it's like, all right, let's have your marriage and your parenting intact and be friendly and polite and nice and be a good strong alpha for your children. And women can be alphas also, right? So it's not just men. But at work, they're not allowed to do that. They can't, or they will die, right? You can't be, ultra compassionate and empathizing on the street, or you'll get stabbed, or in the prison you get shanked, right? So learning how to set a boundary between work and home is very important. And we don't want to deny the part of us that's required for survival. And in society, now we've got this war going on in Iran, and people have opinions about that. Historically, war has always been a thing. And I think modern war perturbs people because, like you said earlier, we believe culturally, at least in the West, that we have somehow evolved beyond this, that we can just negotiate our way out of conflict. And it's like, well, not always. Not
Sure.
everybody shares the same culture. Not everybody shares the same beliefs, morals, values. They didn't all have the same upbringing. So your gang member guy, he is interacting with people. He may evolve, and he may learn to
Sure.
be nice to his peers and his siblings and his mom and his dad, but he is dealing with people who don't have that capacity. They're not in that spot yet, so he can't afford to carve that part of himself out, or he will die. And so there's an evolutionary purpose to why we have these instincts. Now, they're not always appropriate in the classroom setting, and so we want to teach kids the difference. But how do we do that without how do we do that without them suppressing parts of them so that to the point that they whittle away to nothingness, right? They don't believe they know who they are. They think they're worthless. They don't think they're going to amount to anything because they've carved it all out and suppressed it. How do we do that? How do you do that?
Well, so I tell this story often, like with like kids would come into my office and they would get into some kind of like peer conflict and they would be ranting and raving in my office. I'm gonna go beat the shit out of this other kid, blah 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 blah. And most adults go, you can't do that, or that's bad. And I would just play it out with them. All right, well, okay, well, what do you think is gonna happen if you did that? And most often people come to the conclusion of like, it sounds like a lot of work. I'm probably gonna get in trouble. Like it's kind of a pain in the ass. And is there another way to do this? And I was thinking when you were talking along these lines with the prison guard is that my experience in schools is that yeah you have to be this like tough person when you're around all these tough people. I actually thought it was kind of bullshit. I thought that was an excuse often to enact sadism upon other people that pissed you off. And that I was a pretty gentle person at these places. I was very calm. But these kids respected me because I had boundaries also. So you can actually straddle both of these lines that I don't have to be a passive person that you walk all over me. I have my rules. I stick to them. I do what I say that I'm going to do. And there are alternative means to achieving the same goals. And I think people often just don't realize that, yes, aggression is very effective. You can scare the shit out of someone and they'll comply. You can also have someone respect you and they will comply. And so often it's just like presenting that, okay, like your end goal is totally like, I get it. It's reasonable. I want you to really think about though, what are the knock-on side effects of your strategy? And are you cool with that? And if you are, great. Go. Who am I to tell you to stop doing that? But most of the time, my experience is that when people really sit down and look at their behaviors, they realize, oh man, like I'm kind of causing a lot of like the shit in my life that I don't like. And I'm actually interested in doing something different. And that to me is like trying to open that window for people that there is more than one way of solving a problem, but we usually just do what we've been raised to do. And it is very hard. Again, it's hard to deviate. It's just you're so embedded in that family system, culture, all of these things that it's just normal. You're like, well,
So
why would
now,
I do anything else?
yeah, now you and I are part of a contingent of people we've met through the internet and other places that are recognizing that we were bathed in the the niceness, the petting, the affirmation, the validation, the empathy to the point that it becomes self-destructive because we can't help anybody because we're told challenging someone or confronting their behaviors is somehow mean or mean is harmful and harmful is unethical, so therefore just don't do it, right? So now there's a cadre of us who are starting to, I guess you could say, push back on the orthodoxy of what we've been trained to do. And I don't know about you, but I've certainly gotten some blowback for trying to reestablish structure, rules, and I guess those could say be masculine coded.
Sure.
What are we up against here, and how do we right the ship, so to speak, so we can start presenting truth to people and allowing that to penetrate their souls, their psyches, and they can latch onto that and go, yeah, this is true. Like I am destroying my own life. I do need to have self-discipline. I do need to set some boundaries and have some structure and purpose, um, and not just go along to get along because I'm afraid that somebody's going to call me an ism.
Mm. You're asking some hard questions. I
I mean, I
so
am a
yeah,
therapist.
no, of course. I can just tell you what I'm trying to do to solve this issue. So one of the things that I see in this kind of space, like people are going to give me shit for talking to you. Um, And one of my goals is I want to talk to everybody. I've like despised the like schism between the female therapist and the male therapist, and like they're fighting. It feels like they're like fighting for turf rather than like. It seems to me that like 90% of the shit we all agree on, and that especially the ones that are on Twitter are all really fucking competent and really smart, and they spend so much time dissecting the things that are different between us. And that's something that's really bothered me
Yeah.
about our last 10 years of the world is that we have fixated on what is different and we have not tried to, bring each other up. And it's like, hey, you and I are going to have some disagreements about stuff, but I see a lot within you that I like and I want to pull in. And if even those things that I maybe disagree with, well, maybe through our conversations that can shift. I don't have to villainize you to do this. I can actually befriend you and say, hey, well, this is what I think about this. What do you think about that now? And I see change is a lot more effective. And it really bothers me part of that we're so unwilling to speak to one another because we don't like one aspect, or maybe we have a disagreement on how we think therapy should go, rather than what if there's a nugget of truth in each of the things that we're saying and that we're losing something really massive by refusing to speak to one another. So one of the things I'm really trying to do is just talk to everyone and understand their perspectives, why, this group of, let's say, more masculine therapists, for lack of a better term, well, there's probably a problem that they're all coalescing around, and maybe it's not being articulated perfectly that this other side doesn't like, and maybe this other side has a good point that again they're seeing some problem here, and we haven't articulated it. And so rather than being like this side is, there's so much sniping and aggression towards one another that seems unnecessary. So to me, so much of the problem is we have to just communicate with one another and in some ways in good faith, and I want to learn from you. Hopefully you can learn something from me, and we can walk away from the situation having a better understanding. But we're leaving so much on the table. There's so much really smart people that have good ideas that are refusing to interact with one another because of sometimes really petty, to me, kind of petty disagreements.
Yeah, I think the egos are getting in the way. The apparent certainty that we think we have about what somebody's position or another. I have gotten flack for trying to stand in the gaps and present the dialectic. And it seems to be that it's coming from the people who can't get out of their own egos. And I don't know what to do with that other than to dust my feet and walk away. And I'm curious if that's been your experience as well. Because
I think
I,
I take a different approach. I refuse to walk away. I'm going to make you block me. And I'm going to keep being that annoying little person that's poking, like, hey, what about this? Like, what about this? And I have had people, not want to associate with me, be threatened, and all these things. Because again, like it, as if I'm causing some great harm, which I don't think about I am. And I don't like it. Trust me. Like, I actually find it very distressing very often. Like someone that I've interacted with, let's say online, several times very positively, and I say one thing of disagreement, and it's all of a sudden I'm getting such an intense amount of aggression as if I've called you a slur,
right.
like done something like pretty wild. And it is distressing, but I think the only way to do it is like, okay, sorry, I'm just going to create the thing that I want to create. I'm going to push towards the thing that I want, which is more unification. And I mean, that was the whole thing in the school. So, so much of, I was talking about this the other day on Twitter, just going to like what's happening in the world is that we went through a period of, I don't know, last, what, 10, 15 years of, you could call it progressive, woke, whatever label you want to stick on there. And where I was working, I was the only white person I was at. It was 95% or probably 90% black and like another, 5, 10% Latino in the area that I was in. And I was hearing all of these things about how we're so different and we can never really understand each other. And I'm like, every day I'm with these people and we understand each other just fine. We
Yeah.
all feel sadness and hurt and pain and loss and these things. And there's such a fixation on what splits us apart rather than what brings us together. So this is my only thing that I don't know if it's a satisfying solution to your question, which is just keep talking and keep trying to find the things that we agree upon rather than we spend way too much time on what is different about one another. And I think you have to have a lot of courage, but it's scary because, as you said, you're going to get attacked. You're like, why are you talking to this person? Why would you associate with them? Oh, this person did a bad thing. Wait, you're talking to them? Yeah, I'm a
Right.
therapist. I deal with people that have raped people, have maybe even murdered someone, if, depending on the type of work that you do. And are they no less worthy of like dignity and value of like my attention? Personally, I don't believe that they are. I think that they still have something that they could offer. And so, even in the most extreme cases, I'm open to talking to someone because, okay, I've done some bad shit in my life. And I certainly don't want to be painted with that brush for the rest of my life just because I made a mistake. And I'm kind of dumb. I change my mind all the time about things. And I'm probably wrong about a lot of this therapy stuff. Even stuff we've said today, within a week, I might have a totally different opinion. And again, to just write someone off because they believed in a modality or they believed in an author that said a bad thing or did a bad thing is antithetical to me of why I joined this field, which was, well, I want to get to know people and people are messy. I like messy people. I think messy people are interesting, rather than I wanted to, throw them out with the garbage.
Yeah, my experience has been that and I teach grad students and I mentor them, right? I'm not in the academic environment.
Mm.
And I do the internship thing and just like you do, I supervise. And so it's like I'm finding myself having to deprogram the folks coming out of graduate school into believing what you just said. Now, that's been my experience too, is that on the whole, at the ground level, eh, we all agree with what you just said. And maybe this is academia centered. I think so, maybe. I don't know. It seems like the people up there, and I say it's like a hierarchy stratification or something, it's like they're not in the real world. They talk that, but then they don't walk it out. They're the ones doing the catty, backstabbing, sniping, sometimes openly, sometimes privately, and I always end up hearing about it. And I find myself on the outs more often than the ins with my peer colleagues, but the regular people I'm actually treating, they love it, right? They're like, yeah, we're all
Mm,
really the same, right? There's no racial divisions, there's no sexual divisions. It's all we're all just human beings struggling our way through life. And that's not to give permission to bad behaviors and then do business with those people who are perpetrating bad behaviors without,
sure.
you know, reconciling that. But the idea is that there's some splitting occurring, and I don't know how to fix it, but I do know that I keep encountering it. I the deprogramming is the only word I can come up with for how to teach the students who then become licensed interns, who then become licensees, to view people as human beings with great potential for all things great and
Yeah.
terrible, and not as labels as put on upon them by the DEI curriculum or whatever it is that they're all getting infused with in grad school. What's your experience there? Because I agree. I mean, I'm in full alignment with you.
Yeah.
I think
So
I heard you
like
say you're going to get shit for talking to me. I don't know who would give you shit for
probably.
talking to me.
I don't know. But like so I guess a couple of thoughts on this, and it's not even like just DI, even like that political side. It's the DSM, and like we're very fixated on
Yeah,
labeling people and like
yeah, yeah,
these
yeah,
types
yeah.
of things.
Yeah.
And so my experience is that I actually had to do almost no work to deprogram anyone. It goes into another idea. I'll try to kind of dovetail this into, which is
But you
as
are
soon
having to
as
deprogram them, right? You're seeing this?
um they are becoming deprogrammed. I don't think I have to do anything because I guess my concern would be
Fair,
I don't want to be the person to program you, but that puts me
fair.
back into that whole like manipulation
Yeah,
place.
yeah, yeah.
I just I always tell supervisors this is what I might do in this situation, but like what the hell do I know? Like I'm still feel like I'm figuring out this job. But the thing that gets them open to these things is just confrontation with another human being when they actually have to do the work. It's one thing to read about therapy and read about psychology or listen to a professor talk about it. It's another person to sit into a room with someone who, I don't know, is a 50-year-old ex-heroin addict who is, just getting off the street, and you're a 21-year-old intern. It all goes out the window, and you're like, what the fuck am I doing here? I don't know what to do. And then you have a supervisor that's able to sit with you and be like, yeah, okay, let's talk about what to actually do with people and how do we actually do this. And what I have found is that my supervisors were craving for some guidance because they had learned all the theory and the abstract stuff. One of the things I think where grad school, at least in my grad school, like I only speak to my social work program, where it didn't do a very good job is, well, how do I apply this abstract stuff to like people? How do I
Right.
actually work with people? And what does that actually look like? And that was my disappointment was that I thought grad school was gonna be like, oh, you're gonna stop doing book stuff. You're gonna like actually teach me how to do this job. And that it just never happened.
Yeah.
But the other idea that I think this connects to is that, you're kind of talking about these academic people in your eyes are that like they're different things, they're in different places. What I have come to a conclusion, we'll see what you think about this, is I think it's impossible to scale mental health. I think as soon as you start distancing yourself from the people that you are trying to help, they become abstractions and all kinds of weird stuff happens. And that was my experience working in the schools is that, I don't have any illusions that I don't want to like create some new like CBT manual or some therapy and like sell that to other people. I'm the product and like I would love to have like a successful little practice saying what I say and doing what I do. I think all kinds of weird things happen. I don't think it works if you scale these things up. And so, you see the mental health thing, whether it is our, professional organizations or it is academia, they're not treating people very often. They're not touching the people that, they're telling, they're giving me a new a new modality or a new strategy in an SEL program maybe in a school setting and the person who created that doesn't have to go into the classroom and implement that anymore, and they're not dealing with all the constraints that I specifically have to deal with in that school setting. So that maybe your program is wonderful in the environment in which you developed your program. I'm in a different program, in a different constraints and all of these things. And so I have an issue, and I think part of the challenge is that it's so hard to scale these things. And at the same time, I realize I'm being a bit of a hypocrite because I want to talk about how to do this job better. But it's this real paradox of like you can't scale it, but we kind of have to talk to everyone about a problem happening. And I'm not exactly sure how to do it other than say, this is what I have done, this is what I have found successful. And in the same breath, you have to figure this out on your own. And one more breath, and I'll let you respond. Is I was a big fan of Irving Yalom as a writer, and one of his books, his intro books for therapists, is that you have to develop your own therapy for every client that you have. And it was an idea that stuck with me. And I kind of extrapolated every therapist has developed their own style and means to do this. And so you can read a book and that's great. And I think you have to grind and ground yourself in some of the foundational theory stuff. It's very important. You also have to go experiment and you can't be the therapist you read about. You can't be Freud. You can't be Carl Jung. You got to be you. And it's messy and scary. And part of the challenge that I think we've had in these institutions is it's become very concrete. And it's like, this is how you do therapy. And to me, part of our job is, I would say, we are not a hard science, even close. We are maybe a soft science and almost closer to like performance art some of the times. And part of that is you got to be messy and you're going to make mistakes. And you have to have the guardrails to do this, but you have to also have the supervisor that says, yeah, go try something new and have the courage to do this. And not that we're going to be villainize you and say, oh, you're a bad therapist because you tried to take a walk with your client, or do some other kind of creative thing. And it's challenging because at the same breath, there's a lot of wacky shit that therapists do that are totally not helpful. And I don't want that to continue to happen. So one of these things that whenever I end up talking about this, I realize, oh, it is so hard to do this. And I don't know the answer to a lot of these things. All I can try to do is say, this is what I've done. This is what I think has been effective for me. Maybe this might help you. Try it out. But if it doesn't, you're going to have to figure this out also.
You're saying some stuff that flies in the face of what is now passing as conventional wisdom, which is expedience, time limitations, cookie cutter approach.
I
Because
wish.
in our instant gratification society, we want everything now, customized, tailored, streaming, on demand. And that's not how human relationships work. So I think what we end up with coming out of grad school is a bunch of people who are pre-programmed to do a thing, but they do it poorly because they haven't investigated it thoroughly. And then, yes, we all try to be our professors and our mentors and the authors we read with until we find out who we are. But then we don't ever find out who we are. So there's a lot of
Mm,
inauthenticity that gets exchanged. And because we're afraid to step forward, because we're programmed with fear from grad school, if there's lawsuits lurking around every corner or
sure.
something, it's just simply
Yeah,
not true.
it's
Because
terrifying.
if it were true, our liability insurance would be a lot higher than it is.
That's true. It's not very
Um,
expensive.
a
Shocked
couple
me.
hundred bucks a year.
Yeah,
Yeah.
when I first took it out, I was like, oh, this is so cheap. This is crazy.
Yeah. Yeah, no, it's because we never get sued, right? Because it's really hard to say that somebody hurt you and caused damage through talking. I
Sure.
mean, the only time people get sued is for doing wildly inappropriate stuff that's traceable back to the
Yeah.
therapist. So experimenting with a walk, outside instead of direct eye contact across a room, very intimidating setting, by the way. Uh,
Yep.
it sounds scary to the point that you just don't do it. And then we don't evolve as clinicians. And so what we default to is worksheets and rote assignments and check-ins, and nothing ever grows, nothing ever develops because we don't push the patients into disequilibrium so they can grow. So I think you're right. We can scale this, but it requires a return to individualized treatment. Now that's a buzzword because managed care wants everything individualized, and they should because individuals are individual. But we give templates for individualized treatment. It's like that is antithetical to the whole premise. Like that falls in on itself. We have to meet people where they are, not where we think they should be or where we want them to be through our box or our lens. We have to meet them right where they are and work from there. But that's intimidating if you don't have anchored competence, right?
Well,
So, um,
and I
yeah.
think something that's so scary about this field, and what I will try to tell my supervisors is like, hey, this is a bad field if you are uncomfortable with uncertainty.
Hmm.
Because one thing I have been, I guess, humbled is that you never know if what you're doing is helpful or not. And I try to
Right.
keep this in my mind. And it's very hard sometimes where you're like, I think I'm being helpful, but I don't know. And being
And we
able to
almost never get thank you letters, right? So there's no
no.
closure on that loop either.
Well, and I think there's something very important that we communicate this. Again, this is one of my goals is to communicate this to the public that, when I'm telling people in session, I'm like, at some level, what we're doing is throwing shit at the wall and seeing what sticks. Because what worked for someone else, my last client that came in here maybe had wild success, will not work for you. And that doesn't mean there's anything wrong with you. And that's one of my big concerns with a lot of these modalities that they pride themselves on this works for everyone. And you see some of the ads, they're fucking crazy. It's like there was one recently, what was it? No CD. And this was on Twitter and people were talking about it. And the ad was like, this is effective, whatever effective means, for around 90% of our clients. Well, holy shit. If I use this program, it has a 90% effectiveness rate. And if that doesn't work, what about all those people that this doesn't work for? What do they walk away feeling like? And what do they ever engage with the mental health system again? Do they feel like defective? Like, holy shit, this amazing new product didn't work on
Didn't
me.
work.
What is
Yep.
wrong with me? And rather than being like, hey, sometimes these things work with some people and sometimes they don't work with other people. And it's not like a, we just, there's so much, this is my stance, that there's so much we don't know about the mind, the conscious. We don't know what consciousness is. We don't know some of the most very basic things about mental illness, and we often, as a profession, act as if we know a lot more than we do. So I always come from the stance of I don't know a lot. Again, all I can tell you is, hey, this is a thought that kind of popped into my head while you were talking. What do you think about that?
Yeah.
And that's the only honest thing I can really say. And I can say, hey, I have this experience in the past, and I've read some stuff that makes me think this might be what's going on. I need you to help me tell me whether this fits or if it
Will
makes
work
sense to
for
you or
you.
not.
Yeah.
Yeah.
Yeah. And we do this with medicine too. We say, such and such a drug is effective, whatever that means, in blah 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 percentage. And the problem is you can't scale down to the individual the broad-based research anyway, because individuals are always individual. And talk to any psychiatrist or prescriber who's worth a wit, they'll tell you that it's all a one-to-one, N of one experiment in the office setting. And it's like, did you get IRB approval for that? But it is like
It is.
I don't know if Abilify is going to work for you. I don't know if Strattera is going to work for you. We're going to give it a shot.
What?
But if you listen to Jonathan Shedler too, and some of his writing, he'll say that most of the studies, and we all know we have a replication crisis in our field where we can't replicate stuff with any certainty. But we sure will push it, right? Once the one study comes out, we're like, yeah, that's it.
Yep.
And what he'll say is that most of the studies are compared against no intervention at all. It's like, well, that's not useful. Like, of course it's going to work based on nothing. Yeah, something worked. All right. It was effective, more effective than doing nothing. Well, that's a big duh. So we got to be honest about, we didn't corner the market on helping people like in the last 100 years that the profession's been around. I mean, people have been helping each other for millennia. Like, why
Yes.
do we think that we've suddenly figured this out? And I think there are some truisms that, we don't know much about the mind. Okay, maybe from an fMRI imaging comparison standpoint, but we do know stuff. I mean, there's lots of old literature that's been around for millennia, also across many cultures, that we can say with certainty, like men and women are different, right? People tend to want to achieve higher success. Most people don't like living in misery, right? There's certain
Sure.
generalities that we can certainly operate from, and for some reason, it seems like we're afraid to make those statements. I don't know why. Maybe it's the postmodernism infection.
It feels like, at least in my head, it goes, but, well, because it's a generality. It's not always true. And it's so much, there's such a desire to be like, you know, I think our field wants to be like medicine. We're like, oh, I can point at the cancer and there's the cancer, and I'm
Right.
certain about this. And again, it goes
Right.
back to that. I want to be certain about what I'm doing. And the lack of certainty is very difficult. And, I
It's
love that
embracing
Jonathan,
mystery.
I love Jonathan Chetland. And I love the research that I guess the research on the research, which is that, well, what are we even measuring?
Yeah.
What does success mean? And, we're using often these very simple scales that are measuring the day after you finish, very little follow up. And what do these scales really mean? Are they really reflective of a change in your life? Even within the profession, we don't agree on what we're doing. Some of these things
Yeah.
we have yet to iron this out of what we're all doing, and we're all often doing different things. And so if there's a
With a
point
high
that
degree of confidence in our
yes,
ignorance.
I mean, there's no like this is one of Jonathan Shetler's points is that there's no definition for therapy. We don't even know. There's not an agreed upon definition of what any of us are doing. And so to me, that's part of what I think needs to be done right now is we need to actually figure out what are we doing, or what do for me, what am I doing? And I would like to give that a name and some boundaries, and then decide, hey, does anyone else want to do this? Because it's my feeling is that when I talk to people, that there's actually a lot of other people that want to do this, and it's not
Yeah.
obviously my idea. It's ideas that have been thought about for a long time, but we have to seems like recodify what it is that therapists actually are and what we are not, and that is a very hard thing to do. Because once you start drawing those boundaries, you're like, well, what about this exception? What about this exception? And I realized it's a very challenging process to do. But we've gotten so far away from a lot of like the things that, like you said, the things that we kind of know. And we kind of know a decent amount of things. Like I know that humans are greedy.
Yeah.
We always want things. And so I want to create systems that understand that. And I don't want to create a system that doesn't understand that human greed will always be there and there's nothing we can ever do about that. It doesn't seem to make a
Yep.
whole lot of sense to me.
Or that aggression is innate to
Yeah.
males, right? So yeah, so let's conclude there because I'm going to be mindful of time. We kicked this off talking about boys and how they end up being over pathologized for their normal behaviors. Give me a little recap of what you were sharing with Stephanie because I found that really fascinating and I think it's not talked about enough.
Um, so I think this is along that is we've kind of been playing around with is that you made a comment before, like it's obvious that men and women are different. We are. And we're also very similar. And this is why this conversation becomes so hard. Because as soon as you say you're different, then someone else is going to come along and say, like, no, look how similar we are. And it's like, well, both of those things are true. I have different organs. I was walking with my daughter and the other day, and she was like, "Well, why can't you have a baby?" I'm like, "Oh, I have different parts. You have a uterus in your body, and I don't have that." And then in explaining, like, we have just, in of course, that's going to have several knock-on effects and all of these things. And so, for boys and men, we've often got away that men are very visually sexual creatures. It just is what it is. And you talk to any man, especially if you go in any like private room with men or just with men, it'll be openly discussed, talked about. It's on your mind. I describe it as like your eyes feel like they often have magnets towards the female form, and it's very difficult. It actually takes concerted effort to not look at something you find attractive. And I don't know, at least my understanding is that women don't have that same magnetism. And if my understanding is it has lots to do with testosterone and the hormones that are different within our bodies. And it's like, all right, well, what do we do about this? That's often seen as like disgusting or toxic, or it's given some type of label. And yeah, of course it could be. If I'm leering at someone across the room for 20 minutes and being a creep, that's fucking weird, and I shouldn't do that. I also acknowledge if I glance over and then my wife screams at me for doing that, oh, you're mad at me for being human, and that's a problem. And like, where is there? How do we have conversations that are honest? Like, hey, I have this tendency. Where's the line that you would find that this would be, reach infidelity or discomfort on your end, and have a conversation about this as if there's not something disgusting and toxic inside of me. This is just part of my life that I have to deal with and manage. And we have to communicate with, well, how do we best as a, partnership with as, or parents and child. If the kid's hyperactive or is aggressive with his friends, all right, there's nothing wrong with boys playing, and they play rough. I play rough, not anymore with my friends because we've grown out of the physicality, but I play rough verbally with my friends. I am so mean to them, but it's with love. And if you're not used to that, it looks jarring to people. They're like, "Oh
Yeah.
my God, I can't believe you said that to him." And it's like, yeah, it was just funny. And he knows it was funny. And that's how we play. And so all of these things are seen as like a bad thing because I think some of it is like they just don't understand because it's different. And if women were acting the way that maybe you and I act in our group chat, they'd be like, "Oh my God, it's just a different, we have a different form of," it seems to be said. I don't think I'm saying anything controversial, is that men and women exert aggression differently, generally. Not always, but generally, we express our aggression differently. And I think we've become a lot less comfortable with the male form of aggression through violence, competition, and these types of things that tend to be more male oriented.
There's a lot of writing already about and podcasting about why that's happened. I don't care to particularly rehash
Yeah.
that. What's the solution? More conversations, more just stick it out there and just speak the truth of what is.
That's what I'm trying to do. Like I said, that's a million dollar question. And the only thing I have ever figured out how to change anything in my life is for me to just keep talking about it. And then also use myself as I don't know, use myself as the example. Because I want to be honest that like, hey, I have these thoughts and like, someone might be watching this, like, oh my God, what does his wife think about this? We talk about it all the time. My wife knows that this happens and she doesn't feel threatened by it. She knows that, hey, there's lines that we've talked about that like if I ever did anything infidelity, immediately everything would be over. Fair enough. That seems like a fine rule to me. And there are going to be lines, but I want her to have, she has her own set of needs that are not mine. And I want to respect those because we're in a partnership and we're going to figure out, hey, you're different than me and you have different set of needs. And how do we work together to build something together? Rather than, again, this fixation on what is different between us is, hey, we're both moving in the same direction and we have different tool sets. Like, how do we best optimize your tool set with my tool set so we can get where we're going? Rather than, I don't like how you're doing it. It's like, well, but how I'm doing it might work for problem A and how you're doing it might work for problem B. So to me, again, just talking about it, me trying to be honest and admit the things that are scary to admit. Like it's not pleasant for me to admit these things. I'm probably, I'm like, oh shit, what are people gonna think I'm a fucking weirdo for saying these things? But it's just that is happening and we don't talk about it. And that I think so much of it is just it's been never been discussed. And it's only discussed and the tie this into like the manosphere stuff, that's where it's getting discussed. It's getting discussed in the Andrew Tates of the world.
Yeah.
They're touching it and they're getting so much attention and everyone's really mad. They're like, why is this horrible person getting so much attention? Well, because he's fucking talking about it and no one
It's a
else
bit
is.
we've self-censored for too
I like
long.
I don't like the guy. I think there's a lot of things. I think he's wrong about a lot of things. But I'm always fascinated. Well, there's a reason he's getting so much attention.
Yeah, you can't deny the effect.
He's doing something. And so I want to do what he's doing and maybe try to do it in my own way a little bit better with a little more nuance and a little bit more, my background, bringing the things, the psychological things we know about people, bringing that into this. And so have a bit of a better, higher level conversation. But I would love to talk to someone like that and be like, hey, where do we agree? And how can I maybe influence you to like maybe step back from some of the extremes and the excesses of this? But I don't hate you. I think honestly, you've opened up a door for me in many ways, and I can't hate you for this. That you opened up a door for male conversations. It's not exactly how I want it to be, and I see a lot of destructive elements that have come along also with this. But at the same time, there is something there that I think is undeniable. And so yeah, I just want to talk about it, and I want to talk to anyone, people that hate and disagree with me. I want to hear like, hey, I want to understand because I don't inside. I don't think I'm doing anything destructive. I don't think I'm doing anything harmful. I'm trying to just say what I think out loud, and I might be wrong. So you can tell me, and maybe I'll have a better idea later.
Well, there's some people who would say that you're being destructive simply by talking about it because they do want to suppress that, and that's
Yes.
having a deleterious effect on how children develop, either boys or girls. And I think this
Yes.
is why, like, so sidebar to this, I do a lot of work with the firearms community, and so guns and mental health thing, and
Okay.
Mike Sodini, who founded Walk the Talk America, which is the organization I'm a part of, he often says you can hate guns. That's fine. Like you can hate guns. You can want them to go away. What we have to agree on is the commonality that we just don't want people to die prematurely by firearms. Let's start there. Right.
Yes.
And I think too
Okay.
often we're talking past each other, especially with this sex and gender stuff where that's why I like psychodynamics. Psychodynamic theory says that within a human psyche, we have the potential for not just great and terrible behaviors, but also masculine and feminine energies.
Yes.
And so there's a continuum here. You and I have more masculinity in us. We have more animus than anima, but and women will have the opposite typically. And there's a gradient within there. You and I can be feminine in the traditional sense of caring, nurturing, loving, supportive, all that stuff. And women can also be more masculine, structure, authority, provider, protector, that kind of thing. And so if when I start talking about that, people's eyes get crossed because they've only heard that it's a binary. It opens up a lot of opportunity for them to go, oh, okay, so it's okay for me to buy flowers to my wife and it doesn't mean I'm a wuss, right? It's like, yeah, no, you should actually, like, especially if
That's usually
she
a good
likes
thing.
flowers and she's not allergic to them. And for the women, it's okay to put down the foot and send the kids to their room. Dad doesn't have to be there to do that, right? So we can tap into the great potential that we have and also acknowledge that we have the commonality, right? Not the difference, but the commonality within us to do these things and start there and stop pretending like it's binary or that one or the other is bad, right? So you got the
Mhm.
misandrists who don't like femininity, they want to see all the feminine stuff go away, and then you got the misogynists who wanted to see all the masculinity go away. And recently we've had our I don't even know what she's called, a partner in chief or something like that. The Jen Newsom, the governor's wife of California, she's
Oh,
on a talk circuit talking about how it's dangerous that the boys are being exposed online to, yes, Andrew Tate, but also she cited Jordan Peterson. It's like,
oh man,
really?
he's my
You're
favorite.
worried that your son is reading one of the great psychologists of our day? Like this is a problem. And to her, it's a problem because they want to eliminate something. I don't know what it is, but it seems like a very narcissistic power and
Well,
control play.
and that's always what I would love to talk is like, oh, you think this is toxic? Tell me about that. Like, what do you think is actually like, what is the
Right.
actual concern? But so often these are like just like
I wonder
thought
if she could
terminating.
answer. Yeah.
But that's often my experience is that you get what happens is like, all right, this is toxic, and then usually the person then defends themselves. They're like, well, this isn't toxic, rather than like, wait, what are we even talking about?
Help me
Like,
understand. Yeah, yeah.
yeah, help me understand. Like, because I don't, I honestly, I don't want to be toxic. I would rather not be. So help me understand what's the danger that you see, and like maybe you could help me understand something that I didn't see. Because I'm very open to iatrogenic effects of what I'm doing. I may be causing harm without realizing it. That's very real, and it happens all the time in our field. And
Sure.
I don't want to close myself off to that, but at the same time, I'm going to need you to articulate to me what is the actual problem, what is your actual concern that you're having here, rather than often we just get stuck. We get stuck immediately once like this disparaging comment comes out.
Yeah. That's this is all really good. We could probably talk for many hours, but you have dinner waiting you, I'm sure, and I can't smell it through the screen, but if I could, I'm sure it smells delicious. Where can people reach you?
You can reach me on Twitter at Virgil, or I don't even know any of my stuff actually.
I left Twitter, so I don't even
Yeah,
know.
but well, I can tell you my website is just my name, ryanmalphrus.com. I'm on Twitter. I think it is Virgil, VIRGILMSW, which is a
Where's that come
random
from?
student. It was when I was more afraid of being on the internet and I just needed a random name
You
to
just picked like
talk shit.
Dante's
No,
Inferno,
no,
or
no. It's not even that cool. One of my best friend's name is named
oh, that's
Virgil, so
funny.
I just grabbed the name. I'm very not creative. Um,
And how telling
and
is that, by the way, that like there is the self-censorship that we're talking about. You're like, I don't know how much I can share online, right? Like I better like be, pseudonymous.
Oh, I was terrified for the longest. And I tend to think my opinions aren't very harmful, but they tend to be. They tend to cause problems. Because again, I think just asking a question very often can be very feel very threatening. Of like, hey, what do you mean by toxic? And when someone hasn't really fully thought something through, well, that's a
The ego
scary
jumps in.
question.
Yep,
That's
yep,
a real scary
yep.
question to actually ask. So yeah, I think Twitter, I'm always yapping on there. It's fun. I enjoy it. And then on YouTube, I'm trying to do this thing now where I am trying to create just videos where I just talk to people. I want to hear their perspectives on things, and hopefully
Nice.
that we can find agreement amongst different people and within the profession.
Yeah, that's cool. YouTube is what Ryan Malphurs also. You
Yeah,
don't know.
sure,
You
probably.
have no
Yeah,
idea.
I think it's at Ryan Malphris. Yeah, I have a friend help. I'm such a tech boomer. I'm like, hey, my like 26-year-old friend, like, hey, you're gonna figure all this stuff out, and I'm just gonna get on camera and push a button and go. So I cannot do any of this.
That's so funny. Years ago, when I first launched the Zephyr Wellness YouTube channel, so, Zephyr has a YouTube channel. It's got one guy, me, but Zephyr has a YouTube channel. I was editing my own videos in Windows Movie Maker, and then they changed the software, and I don't know how to do it anymore. And I'm like, well, I guess that's the end of me editing videos.
I don't want to learn.
Well,
I don't want to learn. It's a lot of work.
it
A lot of
is.
work.
Well, Ryan Malphurs, thank you very much for joining us, and appreciate the time. You go eat your lovely dinner
Yeah.
and hug and kiss your wife and your kids, and I will see you again on somewhere on Signal or on a Zoom call or something.
Yeah.
We've got some
Well,
things cooking, but
thanks for having me. And yeah, hopefully we'll talk again soon.
yeah, have a wonderful evening.
All right. You too.
And on behalf of all of our Noggin Notes family and Zephyr Wellness crew, we wish you great mental wellness. See ya.